increase in COVID right now. Weekly and daily, we're having multiple patients either cancel because they are positive. Previously, it was just happening maybe once every 2 to 3 weeks. But now it's daily, multiple times a day. So as a result, our schedule's kind of a little hectic.
There's another thing involved if other can suffer due to your behavior, obviously. The iPhone generation, I means me, I. I am the center of the universe. No, you're not. You're a little dust point. And yes, obviously it's your life, and do it, but be respectful to other lives.
Lisa, could you please call me the lab? Ask them how fast can they get me RPD repaired. It is fractured in half. I need to have a frame repaired, and resin, so as soon as possible.
Hey, Mr. Lab, how you doing?
Yeah, people's prosthetics.
Usually my workday starts with coffee, personally. One of our main dental assistants who's been here for 15 years, he's on vacation this week. And Dr. Victoria, who is our second doctor, is also on vacation. So it's just Dr. Twerskoi with 4 columns, plus hygienist columns. It'll be a very busy day.
So, okay, we've got this. What is with you? Are you watching me in the door? So what is here? Здрасте. Hello, how we do?
How are you, Dr. Steve?
You okay?
How are you?
No problemos? Did you bring us couple viruses today? We accept maximum 2,999.
That's all?
Yes, I tell you why. Because in order to get ill, they say you need to get 3,000.
3,000?
Yes, of those viruses. So if you bring us any amount less than 3,000, we don't mind. Stay healthy, thank you very much, you too. As we say, nice turkey. Tarочка, как у нас?
We have a large procedure that is for an implant, bone graft, it's a bridge, things like that. So that'll be a very long procedure in between trying to, accommodate each and every patient equally. It'll be interesting. Good Monday.
Inga is here. Hello, Inga. А что у вас было на прошлой неделе?
А у меня действительно простыла, и так плохо было, что просто невозможно.
So this patient, we have a situation where multiple implants were placed, not in our office many years ago, and just now, recently, she presented with a problem where we can see on the upper right, here was a bridge which was placed on a natural tooth here, which was placed in the middle on an implant, and here distally also on a natural tooth. What happens in this situation, as it happens often if we combine natural teeth with implants and do not take precautions means to preserve the natural teeth, one crown got de-cemented. So now we are dealing with this situation. In addition, how we found out is that implant, so it looks possibly not too bad from this side, but if we look at the 3D picture, it shows that the implant is also not ideally, so it is outside, almost half of the body is outside of the bone. Here on this picture it looks not too bad. The image here reveals, and here we can see that usually we would like the bone to cover the screw from all sides, obviously, and the image reveals that the bone is not. The goal today is to remedy somehow the situation. I anesthetize before I even begin. I obviously need to make sure that we have a proper surgical guide to work with, and one of the most important part is whether it fits. And this is the challenge. All the computers and all the precision, we still need to bring it to the analog world. So we have prepared a surgical guide which will help us to place exactly the implants here in this area, and to place one implant here at the canine area. And since we want to have this as soon as possible done, so today we have the surgery, and we will adjust, make sure that the surgical guide fits. Then after, we will place 2 implants here and here. We need somehow to get a temporary solution, because it will take several months till the implants can be loaded and used for a new reconstruction. So we have here a situation where patient does not have to take it out, so a non-removable temporization. There are other options here, but we want to try this first. So we have here a bridge. I don't know when it was placed, but several years ago, I guess. But we can see here, this implant is bad, almost failed. Here is a beginning problem, but immediate attention would need this implant, but as usually, we cannot address everything at once. And so now we will take care of the situation as described above. And when we do the temporary bridge, here too, we will first ask to produce here a coping to protect that natural tooth. And above this, like telescoping crowns, we will sit onto those 2 abutments, and we'll see how we solve the situation. Over the course of my professional life, I guess I placed somewhat about 10,000 implants.
Нормально?
I'm using this GP implant system from Israel, JP implant. It is handy, it is very comfortable to use, safe to retrieve. We will talk about this, how it was done before the era. There were options to place the implants more precise, but as precise as here, it's not possible. You have to apply common sense. Nowadays, we have this equipment. For example, this X-ray behind me from Carestream, this cost like $70,000, $80,000, $90,000. So obviously it is very new, progressive equipment, but it's very expensive.
Thank you very much.
The modern implantology began in Europe in the 60s, where an orthodontics surgeon by chance discovered that titanium, the metal, is very tissue friendly, so the bone especially likes this metal and bonds to it. Did not even had to do something with dentistry, but he did surgery on other parts and figured out that bone sticks nicely to it. And from there, in the 60s, it began to develop. When patients come sometimes and say that, hey, I'm tired of dealing with my teeth because I need to take care and they break and they decay, so let's take them out and place implants. This is definitely not the right way. And now the euphoria is over, and we understand that there's more into it. As more longer we see these implants in patients' mouths, we understand that it's not ideal. Better is to keep your own teeth, obviously. That's why we always emphasize on dental hygiene, and we always try to save the teeth. Implants is second line of defense.